Hi, I'm Shruti. I'm here to ask Dr. Deepti a few questions on twin pregnancy.
Hi, I'm Dr. Deepti, consultant in fetal medicine, Motherhood Hospital, Hebal.
Doctor, how do we know that we are pregnant with twins?
When you do your urine pregnancy test, when it comes as positive, you will visit your obstetrician and the doctor is going to offer you ultrasound. So, in the ultrasound, we will get to know whether you are carrying a singleton pregnancy or a twin pregnancy. The first ever ultrasound that we are going to do is called as dating scan or a viability scan or early pregnancy scan. The main aim to do the dating scan is to check whether the pregnancy is there inside the uterus or outside the uterus, whether the pregnancy is a singleton pregnancy or a twin pregnancy or higher order pregnancy, and to see whether the fetal pole and the cardiac activity has seen or not, and also to check for any complications like subchorionic hematoma. In addition to this, we also see the ovaries and the adnexal structures. We make a note of any lesions or cysts in the adnexa and the ovaries.
How many scans are required in twin pregnancy?
Generally, there will not be any fixed number of scans that we do for a twin pregnancy, but there will be a regular follow-up scans for the twin pregnancy. The first scan which we do in the pregnancy will be the dating scan, which I have already explained. We are going to confirm whether it's a singleton pregnancy or a twin pregnancy, and if it is a twin pregnancy, which variety of twin pregnancy also will be mentioning it. And the second important scan which we will be doing in twin pregnancy will be the first trimester scan, that is called as NT scan. It's similar to how we do it for a singleton babies. And the third scan is going to be the anomaly scan, which is a mid-trimester scan, which is again very important scan, where we'll be seeing all the structures of the baby in detail along with the growth, the amniotic fluid and the blood flows to the baby. So these are the main scans that we are going to do even for the single babies and for the twin babies, but specifically for the twin pregnancy, there will be follow-up scans every 3 to 4 weeks for a dichorionic twins. But for the monochorionic variety of twins, the follow-up scan starts from as early as 16 weeks. From 16 weeks till 36 weeks, as per the ISUAG recommendations, the scans will be every 2 weeks.
Can we see twins at 7-week ultrasound?
Yes, we can see twins at 7th week of pregnancy. In ultrasound, we can see the sac, the gestational sac, as early as 5 to 6 weeks. When there are twin pregnancy, we are going to see 2 separate gestational sacs or a single gestational sac with the 2 fetuses. So as early as at around 5 to 6 weeks, we can see the gestational sac, and at around 6 to 7 weeks, we do see fetal pole and cardiac activity.
How soon can we realize that we are pregnant with twins?
See, generally, symptomatically, the mothers will have hyperemesis, that is increased episodes of vomiting. They'll have more exhaustion and their beta HCG and alpha fetoprotein levels will be high. These are general symptoms but not very specific for the twins. But the definitive diagnosis or the gold standard diagnosis for the twin pregnancy is always going to be ultrasound.
When does the baby's heartbeat start in twin pregnancy?
For the twin pregnancy or for the singleton pregnancy, the heartbeat we can see in the ultrasound as early as 6 weeks. So there is no fixed time limit for the presence of cardiac activity specifically for the twins. It's same for a single pregnancies also.
Are twins due to mother's or father's genetics?
See, let me explain the background of the twin pregnancy. See, when a woman ovulates, one egg is released and that will get fertilized with the sperm and a zygote is formed. And this zygote is going to get implanted in the uterus, an embryo is formed, and this will turn into a fetus by around 12 to 13 weeks, and thus the baby is delivered. So this is how the singleton pregnancies are formed. In case of twins, in some women, during ovulation, 2 eggs will be released and that will get fertilized with 2 sperms, hence 2 zygotes are formed. So these 2 zygotes get implanted in the uterus and form a dizygotic twin pregnancy. Dizygotic twins are also called as fraternal twins or non-identical twins, or commonly called as dichorionic diamniotic twin pregnancies, or DCDA twins. See, in this variety of twins, there will be two separate placentas and two separate amniotic sacs. So they are just, the babies born at same time. They are not identical. And the speciality of these twins are, they can be of same gender. 50% of the DCDA twin pregnancies, there will be same gender, either boy or a girl, or 50% of the times the DCDA twin pregnancies will have a different genders, like boy and a girl combination. They are genetically different, and they are hereditary. Generally, there will be a family history of twinning, or when the mother would have had a previous history of a twin pregnancy. And most commonly, the family history will be from the maternal side. So this variety is most commonly seen variety in our day-to-day practice, that is the dichorionic diamniotic twin pregnancy. There is another entity called monozygotic twins. In monozygotic twins, what happens is that when egg fertilized with the sperm, a zygote is formed, and this zygote starts dividing. So there are varieties of monozygotic twins. About 1/3 of monozygotic twins gets divided into two within 3 days of fertilization. So this will again form a dichorionic twin pregnancy. That means the babies will be having two separate placentas along with the two amniotic sacs, but their genetics will be same. And in 2/3 of the monozygotic twins, there will be the splitting of the zygote into two babies. So there will be monochorionic placenta, but the babies will be in a separate sacs. There will be one placenta but with the two sacs. So this variety of twins are called as monochorionic diamniotic twin. So generally, when the splitting happens between 4 to 7 days of fertilization, this variety of twins are seen. So they are identical twins. Mostly they will be of same gender, and the genetic components also will be same for both the babies. And there is another variety of twins where the zygote will get divided after around 7 days, between 7 to 12 days, the zygote will get divided. So here in this variety of twin, which is called as monochorionic monoamniotic twins, or a MOMO twins, or MCMA twins, where there will be single placenta and a single amniotic sac. So both the babies will be within one sac. So these babies are also of same gender and same genetic composition. There is another variety of twins. You must have heard about the Siamese, which are called as conjoined twins. So this happens when the zygote divides after 12 days of fertilization. So in this variety of twins, there will be attachment of two babies either in the chest or abdomen. They are lethal. Nowadays, with the increased usage of ultrasound in our day-to-day practice, we will not allow this kind of twin pregnancies to continue. So nowadays, the incidence of conjoined twins have much reduced because of the increased usage of ultrasound in our OPDs.
Will my twins be born prematurely?
Not really. Not every twin pregnancy end up in premature labor, but 20% of the preterm deliveries are because of the twin pregnancy. When we have twins, it is double the happiness, but at the same time, it comes with the baggage of complications. There are maternal complications and fetal complications associated with the twin pregnancies. For the mother will be at increased risk of developing preeclampsia, that is high blood pressure in the pregnancy. There will be having increased chances of developing high blood sugars, that is gestational diabetes. There will be increased risk for anemia, and the mother can go into PPH post-delivery, and increased chances of cesarean section because of the abnormal presentation of the two fetuses. For the fetuses, there will be increased chances of developing aneuploidies, that is chromosomal abnormalities or structural abnormalities are more common for the twins, and also the growth restriction, which leads to premature deliveries. And prematurity comes with a bag of complications, which can be the immediate perinatal morbidities or mortalities or long-term morbidities. Generally, the twin pregnancies, we do anticipate and expect the preterm labors, but we do screening for the prematurity. We do a regular cervical length checkups in the twin pregnancies. If the cervical length is shorter, a prophylactic cervical stitching can be done so that the pregnancy can be prolonged up to 36-37 weeks.
Do twins share the same placenta?
Yes, I told you the monochorionic variety of twins share the same placenta. That's why they are called as monochorionic diamniotic variety or a monochorionic monoamniotic varieties of twins.
How important is ultrasound surveillance in twin pregnancy?
Ultrasound is the very important modality in the pregnancy, in any pregnancy, but specifically for the twins, they may require extra surveillance because of the complications associated with the twin pregnancy, especially for the monochorionic twin variety. I would like to stress few important points regarding the monochorionic variety of twins. Monochorionic variety of twins will have a specific complications like TTTS, which is also called as twin-twin transfusion syndrome, where there will be unequal distribution of blood between the two babies. So the babies, one becomes smaller baby, one become bigger baby. So in this kind of twins, there will be increased mortalities and morbidities for both the twins. So to salvage these babies, we are going to do fetoscopic laser ablations to treat them. The ultrasound, the regular follow-up of through the ultrasound is very important to anticipate these complications. Another rare complications associated with the monochorionic twins will be TAPS, that is twin anemia polycythemia sequence, or twin reversal arterial perfusion syndromes, and selective fetal reductions. So these are the few complications which are specific for the monochorionic diamniotic twin pregnancies. So when a couple carrying MCDA twins, they are primed with these kind of informations in our OPD, and also a regular follow-up scans will be recommended in these kind of twins. And there is another variety of twins which I already spoke about, that is called as monochorionic monoamniotic twins. They are MOMO twins, which are identical twins, where there will be no intertwin membrane between both the twins. They'll have only one amniotic sac and one placenta. In these type of twins, along with the TTTS and TAPS complication, they also will have increased mortality because of the cord entanglement. And this variety of twins are more prone for preterm deliveries. So a regular follow-up scans are a must in twin pregnancies. So do not miss your antenatal consultations and ultrasound surveillance if you are carrying twin babies. So Motherhood Hospital, we are equipped with treating and managing the twin pregnancy. Twin pregnancy is considered as a high-risk pregnancy, and a multidisciplinary approach is required to manage these pregnancies. The team includes obstetrician, fetal medicine specialist, neonatologist, and anesthetist to manage these kind of pregnancies. And our hospital, which is a high-risk center to manage high-risk pregnancy. If you are carrying twins, do not worry, we are here to manage you effectively. A healthy mother and healthy baby is the motto of our hospital. Thank you very much for your patience listening.
Thank you so much, doctor, for your valuable time and input on twin pregnancy. I'm sure this will reach out to a lot of women who are expecting twins. Thank you.